You might not be able to breathe well, and you don't know why. Here's what you need to know. Your respiratory system helps you breathe and get oxygen to your body, but sometimes, breathing may become difficult. This guide explains lung anatomy, how gas exchange works, differences between COPD, asthma and pneumonia, how pollution may damage alveoli over time, and early signs of declining lung function. This content is for educational and informational purposes only, and is not medical advice. Always consult a qualified healthcare professional regarding health concerns. Let's start with lung anatomy. Your respiratory system includes your nose, mouth, throat, windpipe, and lungs. Air enters through your nose or mouth, moves down your throat, and goes through your windpipe, called the trachea. The trachea splits into two tubes called bronchi, which go into each lung. Inside your lungs, bronchi split into smaller tubes called bronchioles. At the end of bronchioles are tiny air sacs called alveoli. Alveoli are where gas exchange happens. Oxygen enters your blood, and carbon dioxide leaves your blood. Now let's talk about gas exchange mechanics. When you breathe in, air fills your alveoli. Oxygen from the air moves across the alveoli wall into your blood. Your blood carries oxygen to your heart, which pumps it to your body. At the same time, carbon dioxide, a waste product, moves from your blood into your alveoli. When you breathe out, you exhale carbon dioxide. This gas exchange is essential for your body to get oxygen and remove waste. Now let's compare COPD, asthma, and pneumonia. These are different conditions that may affect breathing. COPD stands for chronic obstructive pulmonary disease. COPD is a long-term condition that may cause breathing difficulty. It often happens over time, especially with smoking or exposure to harmful substances. Signs that may appear include shortness of breath, wheezing, cough, and fatigue. COPD may include chronic bronchitis and emphysema. Asthma is a condition where your airways may narrow and produce extra mucus. Asthma may come and go. It may be triggered by allergens, exercise, cold air, or irritants. Signs that may appear include wheezing, shortness of breath, chest tightness, and cough. Asthma may be managed with medications and by avoiding triggers. Pneumonia is an infection in your lungs. It may be caused by bacteria, viruses, or fungi. Pneumonia may make your alveoli fill with fluid or pus. Signs that may appear include cough with phlegm, shortness of breath, fever, chills, and fatigue. Pneumonia may require medical treatment and sometimes antibiotics. How do you know which one you have? Only a clinician can evaluate what breathing difficulty may mean. If you have breathing problems, schedule an appointment with your clinician. Now let's talk about how pollution may damage alveoli over time. When you breathe in polluted air, harmful particles may reach your alveoli. These particles may cause inflammation and damage over time. Long-term exposure to pollution may reduce lung function and increase risk for breathing problems. Sources of pollution include vehicle exhaust, industrial emissions, smoke, and dust. Protecting yourself from pollution may help support lung health. Now let's cover early signs of declining lung function. Signs that may appear include shortness of breath during activities you could do before wheezing or noisy breathing, cough that doesn't go away, fatigue or feeling tired more often, chest tightness or discomfort. These signs can have many causes, and only a clinician can evaluate what they may mean. But if you notice these signs regularly, ask your clinician about evaluation. Your clinician may recommend tests like spirometry, which measures how much air you can breathe out and how fast. If you're concerned about lung health, schedule an appointment with your clinician. Share your symptoms, how long you've had them, and any exposures like smoking or pollution. Keep a simple health log with dates, symptoms, and patterns. Bring this to appointments. For lifestyle factors that may help support lung health, avoid smoking, limit exposure to pollution, exercise regularly, maintain good air quality at home, and manage other health conditions. If this was helpful, subscribe for more clear, evidence-aligned health education. Share this with someone who may find it useful, a family member, friend, or caregiver. Understanding your respiratory system and early signs of declining lung function can help you take thoughtful, informed steps for your health. This content is for educational and informational purposes only, and is not medical advice. Always consult a qualified healthcare professional regarding health concerns.